Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, and welcome back to the Diverse Thinking, Different Learning podcast. It is so good to have you with me today. I am actually on my own today, and I'm talking about a topic that impacts millions of children, teens, and adults around the world, ADHD. But specifically, I'll be focusing on ADHD assessments. I'll be diving into a number of aspects of this process, why no ADHD assessment is complete without reviewing lifestyle factors, ruling out other medical conditions, and probably most important, sharing feedback and recommendations with families. ADHD is a chronic, often lifelong condition, and it's important that we understand how the assessment process works to set children and families up for success. So let's get to it. So like I was saying, ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder that affects people across the lifespan. It's often diagnosed in childhood, but more than 50% of adults diagnosed in childhood continue to experience significant symptoms into adulthood. And what that means is that ADHD isn't just something that children grow out of. It often requires lifelong monitoring and support. Now, one of the most important steps in addressing ADHD is getting the diagnosis right. And that's what we're focusing on today. An evidence-based ADHD assessment includes multiple steps to ensure that we gather all the necessary information. It's important for people to know that we don't diagnose ADHD based on test scores alone. The diagnosis is based on meeting specific behavioral criteria set out in the DSM-5, which is the Diagnostic and Statistical Manual. And what we do is we examine those behaviors and see if they include a pattern of inattention, hyperactivity, and impulsivity that impacts functioning in multiple settings, like at home, in school, and in social situations. An ADHD assessment typically starts with a thorough clinical interview. And during the interview process, a clinician will gather a detailed developmental history. So what we're doing is we're looking at how the child or teen has developed over time. We look at things like when they reached key milestones, their early learning experiences, and whether there were any issues during pregnancy, birth, and delivery, such as tobacco or alcohol exposure. And what the interview process does is it allows us to see whether or not a child has risk factors for ADHD. The interview also includes a detailed medical history. And what that does is it helps us rule out other medical conditions that might mimic ADHD symptoms. We look at sleep disorders, thyroid problems. We'll ask questions about that. Ask about vision and hearing evaluations, because sometimes issues with vision and hearing can present as inattention or hyperactivity. And if there are concerns or questions about whether or not there are significant medical issues, we will often refer back to the pediatrician, to the family doctor, to rule out certain things before we proceed with the ADHD assessment. But a medical review helps us to rule out these potential causes of inattention, hyperactivity, emotional dysregulation, and all of the other things we often see in ADHD. An ADHD assessment will also include a review of lifestyle habits that can influence attention and behavior, such as sleep patterns, exercise routines, and screen time. So we want to know how long a child is sleeping. Is it easy for them to fall asleep? Do they get up in the middle of the night, which means there are disruptions in sleep? We're also going to ask about screen time because we know that there's a link between screen time use and sleep patterns, as well as a link between screen time, attention, and emotional dysregulation. I will link to those episodes in the show notes. In teens, it's important to also review substance use, such as drugs or alcohol, that can impact attention and behavior. Now, teens may not always be forthcoming about their drug or alcohol use, but we definitely want to ask the questions because use can often impact attention and behavior. So I'm going to review again why asking about lifestyle factors is really an important part of an ADHD assessment. And again, it's because lifestyle factors can significantly impact behavior and attention. For example, we know that poor sleep can make attention difficulties worse. Screen time, especially excessive use of electronic devices, can also have an impact on attention and behavior. And we shouldn't forget about exercise. Regular physical activity is incredibly beneficial for children with ADHD. It improves their focus and their ability to regulate their emotions. So when assessing ADHD, we are taking a holistic view of a child's life. Are they getting enough sleep? How much time are they spending on screens? Are they regularly engaging in physical activity? These factors don't cause ADHD, but they can certainly make symptoms better or worse. We also review a child's functioning across multiple settings. That's also part of an ADHD assessment. Again, ADHD is a disorder that impacts functioning in many areas of life. So we'll want to gather information from parents, teachers, and sometimes others who interact with the child in different environments. That might be a coach, it might be a tutor. All of this information can be incredibly helpful. And what it does is it helps us to rule out other explanations for symptoms like anxiety, trauma, learning difficulties, or not liking their academic environment. Next, we use standardized rating scales to collect information about a child's behavior. Now, these scales are completed by parents and teachers, and what they do is they ensure that we're gathering data, again, from multiple sources. The goal is to see if a child's behavior aligns with behaviors and symptoms commonly associated with ADHD when that teen is compared to their peers. Is Justine showing more struggles with distractibility than other girls her age? Is Jacob having more trouble with organizing and planning than we would expect for a boy his age? Are they having just a little more difficulty, or are they experiencing clinically significant struggles? So this is all part of what an ADHD assessment will look like. And while these rating scales give us valuable data, valuable information, it's important to remember that they're just one part of a puzzle. We never diagnose ADHD based on scale scores alone. Instead, we use them to support a clinical picture, and then we get context from those rating scales by speaking directly to parents and teachers. Many parents have asked about cognitive and neuropsych testing, and so I'm going to talk about that. Cognitive and neuropsychological assessments can help us understand a child's executive functioning, their functioning in other cognitive areas. Executive functioning is particularly important because it's an area of struggle for those with ADHD, but it's important to emphasize that these tests do not diagnose ADHD, and you do not need a neuropsychological assessment to diagnose ADHD. I'm going to say it again. You do not need a neuropsychological assessment to diagnose ADHD. Now, a neuropsychological assessment will tell you, however, how ADHD, if it is there, impacts other cognitive and academic areas. And a more comprehensive evaluation will tell you if there are co-occurring issues, a co-occurring disorder that also needs to be addressed. So there are benefits to doing a more comprehensive evaluation. But when people just want to know, is ADHD present? Does my child have ADHD? A neuropsych assessment is not necessary. Now, testing is helpful for understanding a child's cognitive strengths and challenges and for guiding interventions. But the diagnosis of ADHD is still based on the DSM-5 criteria and not on test scores. Finally, no ADHD assessment is complete without a feedback session where the clinician sits down with the family to review the results and make recommendations. This is a critical part of the process. Now, during the session, what I do is I share data that we've gathered from the interview, rating scales, and any testing. And I explain whether or not the child meets the criteria for ADHD, and if so, what the next steps are. An ADHD assessment should also include a feedback session with the child because the child needs to know their learning profile. They need to know if they're struggling with attention and what we are going to do to provide support for them. The feedback session is also a time to address any concerns or misconceptions that families might have. For example, some parents may worry that an ADHD diagnosis means their child will need to take medication for life, or that medication will change their child's personality. These are absolutely valid concerns, and it's important to provide families with evidence-based information to help them make informed decisions on what they're going to do next. What are the treatment options they are going to pursue for their child, for their teen? And so it's really important to have that feedback session, and it should be part of an ADHD assessment. So remember, ADHD is a lifelong neurodevelopmental disorder that requires careful and thorough assessment. And that assessment involves gathering data from multiple sources, ruling out medical causes, reviewing lifestyle habits, and sharing detailed feedback with families. So at the end of the process, parents should know whether or not your child or teen has ADHD, the type or presentation of ADHD, whether that's inattentive presentation, hyperactive impulsive presentation, or a combined presentation. And I will put a link in the show notes to an episode where we discuss the different types of ADHD. At the end of the ADHD assessment, you should also know how ADHD impacts your child's life and have recommendations for next steps. This evidence-based approach ensures that children and families receive the most accurate diagnosis and the best possible support moving forward. I hope that you found this episode helpful. Thank you again for listening. I really appreciate you. For more information, resources, or to connect with experts, visit us at childnexus.com. Be sure to subscribe so you don't miss out on future episodes where we continue to explore new ways to support children with learning and processing differences. Until next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.